A crisis is unfolding, the looming shadow over American healthcare. The United States faces a critical challenge. A shortage of nurses is gripping the nation, casting a long shadow over the healthcare system. This crisis affects every aspect of care, from hospital bedsides to community clinics. Patients feel the strain, healthcare professionals grapple with the consequences, and the entire system groans under the weight of this shortage. The nursing shortage is not a new phenomenon. History offers numerous examples of similar crises, each one underscoring the vital role nurses play in healthcare. In the aftermath of World War II, for instance, the U.S. grappled with a severe shortage. Poor working conditions and inadequate pay drove many from the profession. Today, the echoes of those past challenges resonate as we confront a new iteration of this recurring problem. The COVID-19 pandemic, with its relentless demands and emotional toll, exacerbated existing strains within the nursing profession. Burnout rates soared, and many nurses, exhausted and disillusioned, chose to leave the profession. Numbers tell the story. A statistical snapshot of the U.S. nursing shortage. The U.S. needs 193,000 new nurses annually until 2032. Nursing schools will produce only 177,400 graduates each year. This results in a shortfall of over 15,000 nurses annually. States like Utah, Georgia, and Texas have only 7 nurses per 1,000 people. The price of scarcity. How nursing shortages impact healthcare delivery. The consequences of the nursing shortage reverberate throughout the healthcare system, impacting the well-being of patients and the ability of healthcare institutions to provide quality care. As hospitals and clinics grapple with understaffing, patients experience the fallout firsthand. Longer wait times, reduced access to specialized care, and an increased risk of medical errors become unfortunate realities in an overburdened system. Studies have shown a direct correlation between nursing shortages and adverse patient outcomes. A higher patient-to-nurse ratio, a direct result of understaffing, has been linked to increased hospital-acquired infections, medication errors, and even mortality rates. These findings underscore the critical role nurses play in ensuring patient safety and well-being. When nurses are stretched thin, their ability to provide optimal care is compromised, potentially jeopardizing patient health. The financial stability of healthcare institutions is also threatened by the nursing shortage. Hospitals facing chronic understaffing often resort to hiring expensive temporary nurses to fill the gaps. This reliance on agency nurses, while necessary to maintain basic operations, places a significant financial strain on hospitals, particularly those in rural or underserved communities. The nursing shortage also contributes to a vicious cycle of burnout and attrition within the profession. Unraveling the roots. Why are nurses leaving the profession? To effectively address the nursing shortage, it is essential to understand the underlying causes driving nurses away from the profession. One of the most significant factors contributing to the nursing shortage is burnout. The demands of the profession, often involving long hours, emotionally taxing situations, and physically demanding tasks, take a toll on nurses' mental and physical well-being. This burnout is further exacerbated by chronic understaffing, leaving nurses feeling overwhelmed, undervalued, and ill-equipped to provide the level of care they aspire to deliver. Another contributing factor is the perceived lack of career advancement opportunities within the nursing profession. While nursing offers diverse career paths, many nurses feel limited in their ability to progress within their chosen field. Furthermore, the nursing profession faces challenges in attracting and retaining younger generations. Millennial and Gen Z nurses, known for their desire for work-life balance and career flexibility, often find the rigid schedules and demanding work environments of traditional nursing roles unappealing. Education at a crossroads, the struggle to train tomorrow's nurses. The nursing shortage is not solely a result of nurses leaving the profession, it is also a reflection of the challenges faced by nursing education programs in attracting and graduating qualified candidates. Nursing schools across the country are grappling with a multitude of obstacles that limit their capacity to train the next generation of nurses. One of the primary hurdles faced by nursing schools is a shortage of qualified nursing faculty. Experienced nurses, often lured by better pay and less demanding work environments, are increasingly choosing to leave academia for clinical practice or other career paths. This shortage of educators limits the number of students nursing schools can accept, even as the demand for nurses continues to rise. Beyond faculty shortages, nursing schools face financial constraints that limit their ability to expand programs and invest in essential resources. Outdated facilities, limited access to simulation labs, and a lack of funding for faculty development all hinder the ability of nursing schools to provide students with the high-quality education they need to succeed in today's complex healthcare environment. Moreover, nursing programs face challenges in securing adequate clinical placements for students. The aging workforce. A generational shift with profound implications. The aging U.S. population is a significant factor contributing to the growing demand for nurses. As baby boomers enter their golden years, their healthcare needs increase, placing a greater strain on an already overburdened system. Compounding this challenge is the fact that the nursing workforce itself is aging, with a significant portion of nurses approaching retirement age. Data from the National Council of State Boards of Nursing reveals that approximately 500,000 registered nurses are currently 50 years or older, with nearly 1 million over the age of 40. This demographic trend suggests that a wave of retirements within the nursing profession is imminent, potentially exacerbating the shortage in the coming years. Losing seasoned nurses means losing a wealth of knowledge, expertise, and mentorship that is crucial for training the next generation. However, it also creates opportunities to rethink traditional nursing roles, embrace innovative staffing models, and create more flexible career paths that appeal to a new generation of nurses. Immigration impasse tapping into a global talent pool. The global shortage of nurses presents both challenges and opportunities for the United States. While the U.S. struggles to fill nursing vacancies, other countries face similar shortages, creating fierce competition for qualified nursing professionals. To address its domestic shortage, the U.S. must consider reforming its immigration policies to attract and retain international nurses who can contribute their skills and expertise to the American healthcare system. Historically, the U.S. has relied on foreign-trained nurses to supplement its domestic nursing workforce. However, complex immigration processes, limited visa options, and lengthy processing times create significant barriers for international nurses seeking to work in the U.S. Streamlining the immigration process for qualified international nurses could provide a much-needed influx of skilled professionals to address critical staffing shortages. By simplifying visa applications, reducing processing times, and providing support services for foreign-trained nurses, the U.S. can create a more welcoming environment that attracts and retains top talent from around the world. Charting a path forward. Solutions to stem the crisis. Addressing the nursing shortage requires a multifaceted approach that tackles the problem from multiple angles. It demands a collective effort from healthcare institutions, policymakers, educators, and nurses themselves to implement sustainable solutions that will attract, retain, and empower the nursing workforce of the future. One crucial step is to improve working conditions for nurses. This includes addressing issues such as inadequate staffing ratios, lack of support staff, and limited opportunities for professional development, implementing safe staffing ratios, investing in ancillary staff to alleviate non-nursing tasks, and creating career ladders that provide clear paths for advancement can significantly improve job satisfaction and reduce burnout among nurses. Investing in nursing education is paramount. This includes increasing funding for nursing schools, offering loan forgiveness programs to incentivize students to enter the profession, and expanding scholarship opportunities for underrepresented minorities. Additionally, creating partnerships between nursing schools and healthcare institutions can provide students with valuable clinical experience and facilitate a smoother transition into the workforce. A call to action. Securing the future of nursing, securing our health. The nursing shortage is a complex and multifaceted challenge that demands immediate attention and a collective effort to implement meaningful solutions. It is a crisis that affects us all, as the well-being of our healthcare system is inextricably linked to the well-being of our nurses. As we move forward, it is imperative that we recognize the invaluable contributions of nurses and elevate the nursing profession to its rightful place as a cornerstone of our healthcare system. This requires a fundamental shift in perspective, a recognition that investing in nurses is not an expense, but rather an investment in the health and well-being of our nation. We must all become advocates for nurses, supporting policies that promote safe staffing ratios, fair compensation, and improved working conditions. We must encourage young people to consider nursing as a rewarding and fulfilling career path, and we must work together to create a healthcare system that values, respects, and empowers nurses to provide the highest quality care to all.